I actually think this eating protocol, this style of eating, can turn cancer into a chronic disease. In other words, there may always be some cancer cells. We know this with glioblastoma patients, brain cancer patients, that it never goes away. And Tom Zefried's done a lot of this work. And when people kind of go off the diet a little bit, the tumor actually grows again. And then when they get back on it, it reduces. So I think the diet can actually be used much like we treat type 2 diabetes or other chronic diseases, prevent it from growing and metastasizing, which is really what we want.
Okay, good morning. Dr. Fontaine, can you hear me?
Yes, Dr. Baker, how are you?
Yeah, I'm good. Thanks for doing this, by the way. I appreciate this. I am interested in, you've got some interesting work that you've done. I guess if you don't mind, just for the sake of the folks listening, could you share your background with us?
Sure. Before I do that, I just want to tell you, I did some push-ups before I came on.
You're
Not
better.
100, of course, but
I have not done mine yet this morning, so you're up on me. So good for you. Awesome.
all right. Well, so my background, I've trained in psychology, and I have a degree in counseling psychology. And I was actually, my wife is British, so I got my Ph.D. in England and got on the faculty at a university there. Happened to see an opportunity for a postdoc at Johns Hopkins. So somehow I managed to convince them that I was appropriate because I'd never really done anything with obesity. Most of my work was on something called dispositional optimism, which is like having a positive outlook and how that can influence your outcomes. Anyway, managed to parlay that postdoc into a faculty appointment at Hopkins in gastroenterology, and then later in rheumatology. Was there about 15 years. Moved here to the University of Alabama at Birmingham in 2012. Interests, I have varied interests, which makes it difficult, but the underlying interest is really the effects of diet composition. When I did my postdoc at Hopkins, this was in the mid-90s, and the treatment was essentially a very low-calorie diet, the VLCD, which was basically shakes and one meal. And what I observed there is the caloric deficit and the fact that it was low carb put people into ketosis. People lost remarkable amounts of weight. Can't tell you the number of people who said, if I could eat this way the rest of my life, I would, because I'm not hungry. Everything's great. And then for some reason, still happens today, we have this idea that we have to transition them back to the standard American diet to get the carbs back. Because again, some people still think carbohydrates are an essential macronutrient. And they did this thing called transition, which is has a different meaning today. But basically, the idea was to get them back on carbs. So what happened, of course, is they regain their weight. They get heavier than they were before. And I began to recognize that what we're doing is not working. This idea that they're in an eating pattern that's working for them, and yet somehow we have to transition them back, just didn't make sense to me. And then I ran into a lot of the work of Gary Taubes, who was basically mirroring my experience. And I became an advocate for the low carbohydrate / keto diet. And I've kept off about 40 pounds. It's been about 20 years. And I counsel a lot of my colleagues here. And I there's a pre-diabetic person recently, got him on this regimen, lost weight, all his markers improved. And he's a biostatistician. And he said to me, I don't need a clinical trial to tell me that this works. So that's kind of where I'm coming from. Recently, we've tried to apply some of the diet stuff on chronic disease. And, the paper that you identified with me is the paper we did in 2018 looking at cancer. And I'd be happy to outline what we found if you'd like.
Yeah, that'd be awesome. Just a couple of comments. I guess the idea that it's not sustainable. I mean, I know people have been doing ketogenics, low carb diets for literally decades, and they're fine. I mean, there's no there's no background incidence of heart disease and any other thing, certainly, and most likely better than the standard diet. And so,
Yeah.
again, I'm just not sure why this desire to, be hungry again, because like you said, there's a profound loss of hunger and satiety that
Yeah.
occurs with these types of diets. And I think that's a huge part of the puzzle. Do you, 'cause, your background in psychology, and now you said gastroenterology and rheumatology, it's a very disparate sort of path that kind of circuit, kind of like what I did. I'm an orthopedic surgeon. I'm here talking about friggin'
Yeah.
diet. It's kind of like crazy, but let me ask you. So yeah, that paper you saw, and I didn't I didn't read it in depth, but I looked, kind of looked over it. But I mean, basically, ketogenic diets, ovarian cancer, I believe, and we saw some changes in visceral fat and some other markers, I believe. Was that what we were looking at? Yeah, go ahead and
Yeah.
outline some of the
So
markers.
we, fortunately we had some buy-in from the gynecological oncologists on this campus. Otherwise, you can't do these studies. But we happened to find a younger person and a more senior person. So we got some funding and we randomized women with, it was either ovarian or endometrial cancer at various stages of treatment, which is one of the limitations. And we randomized them to a ketogenic diet or the American Cancer Society diet, which is essentially the standard American diet. And for 12 weeks, we put them on this diet. We looked at body composition through DEXA. We looked at CA125, which is a marker of cancer, and insulin and metabolic panels. And we essentially found that, and these women, the mean BMI for the entire cohort was 31. So they were obese women. In the ketogenic group, we saw about a 21% reduction in visceral fat with a maintenance of lean tissue, compared to the other group, which had about a 5% loss in visceral fat. The other thing is obviously insulin levels went down, fasting insulin levels went down. Most of the women in the ketogenic diet through urines were in ketosis. Most of them had at least 0.5 millimolar. So the beta hydroxybutyrate suggested they were in ketosis. And beta hydroxybutyrate correlated with a reduction in IGF-1, which is thought to be sort of one of the nutrient sensors that can fuel tumor growth. So essentially what we found is the diet produced a selective loss of adiposity, which is always good, especially to reduce the risk of a recurrence in these women. And again, reduction in insulin. So if insulin does play a role, which it probably does in feeding cancer cells, at least we managed to quell that process. Quelling inflammation, I think, is really important. And the selective loss of body fat. And the exciting thing is at least one of the markers that tends to drive some of the cancer, the IGF-1, was significantly associated with being in ketosis. So that suggests to me that at least as an adjunct treatment, this might be something to consider. There's an independent line of research that also shows that a ketogenic diet seems to make the cancer cells more sensitive to the effects of treatments, particularly radiation. And we also know that a ketogenic diet can minimize the really toxic side effects of going through something like chemo. So it seems to be a no-brainer that this is the kind of protocol that should be, to me, it should be a standard of care for someone undergoing cancer treatment. Of course, we're a long way from that.
Yeah, I mean, I often, that's one of the things I see. I've seen a few people go through cancer and they've been on these low carb, ketogenic, even carnivore diets, and they routinely say that their oncologists routinely comment how little they have of side effects. They tend not to have much nausea. They tend not to have as much discomfort and insomnia and those types of things. So I think there is something there for sure. Did they look at actual, I mean, cancer outcomes? I mean, you talked about markers like IGF-1 and some of these other things, visceral adiposity, but were there any markers that like these people had a greater recurrence rate or a lower recurrence rate, or was that?
Unfortunately, we haven't been able to follow these women. And we wanted to look at what happened to the tumor over the 12 weeks, and we weren't able to do that, unfortunately. So to answer your question, no. But I would suspect that I think one of the real benefits of this eating plan for someone who's had cancer might be to reduce the risk of recurrence. And ideally, what you'd like, I actually think this eating protocol, this style of eating, can turn cancer into a chronic disease. In other words, there may always be some cancer cells. We know this with glioblastoma patients, brain cancer patients, that it never goes away. And Tom Zefried's done a lot of this work. And when people kind of go off the diet a little bit, the tumor actually grows again. And then when they get back on it, it reduces. So I think the diet can actually be used much like we treat type 2 diabetes or other chronic diseases, prevent it from growing and metastasizing, which is really what we want. Because a lot of people, as you know, die with prostate cancer, but not from prostate cancer. So,
yeah, when you talk about males, I mean, gosh, I think it's like something like a third of all males end up with prostate cancer. If they live long enough, yeah, they usually die of something else because it tends to be so indolent and slow growing that it doesn't cause problems. I've interviewed Thomas Seyfried a couple times. You know, I'm very familiar with his work and his work around glucose and glutamate, or glutamine rather, and
yeah.
some of these things. So it's quite, you know, we're seeing this a lot among a lot of different researchers, and so it's kind of a you know, I guess exciting, but at the same time, you just wonder why it isn't becoming more mainstream because, you know, obviously there's not the money in there, as we know, and that's sort of
Yeah.
a challenging thing. Do you, you know, with putting your psychologist hat back on, how much of that, because one of the things, you know, you might have a diet that's technically going to work well for somebody for their condition, you know, say like, you know, with diabetes, you know, we know that lower carb diets generally do a pretty good job at lowering hemoglobin A1C and decreasing the rate of diabetic complications. But, you know, getting people to do that, you know, is sometimes hard. I mean, sometimes they don't want to
Yeah.
do it. So how do we do it from a psychological
Well,
standpoint?
it's psychology and behavioral strategies don't help much with the traditional calorie deficit, you know, energy in, energy out, because you're asking people to do two unnatural things. You're asking them to be hungry, and at the same time, you're asking them to expend more energy. So that can, no matter how much willpower you have, that cannot really sustain itself. So one of the, and I think my profession has done a disservice to obese people um, by thinking it's a willpower issue and it's a strategy issue. I think of the John Cougar Mellencamp song, which says, "I fight authority, authority always wins." Obese people fight physiology, and physiology always wins. So it's not that I don't think obese people are obese because they overeat. I think they overeat because they're obese, because they have all this stored energy that they can't get access to because of the diet composition that they're consuming. So they are genuinely hungry. So that's why I am so intrigued by the ketogenic and the carnivore, because you are allowing the participant, the patient, to get access to their fat stores, because you're keeping insulin low, which releases the fat, the stored fat, and reduces inflammation.
Yeah, we see, and you know, David Ludwig wrote the book Always Hungry, and it's kind of a similar sort of vein.
Yeah.
And you know, yeah, I mean, and I think, you know, if you're going to succeed in the diet, constant hunger is not going to be part of that success formula. That and unpalatable food. You know, somebody
Yeah.
tells me I got to eat something, I'm hungry all the time, and I don't even like the food. I mean, goodness, you're setting people up for failure right from the beginning.
The interesting thing is calories obviously are important, right? So we did another study with older adults, and we basically put them on a ketogenic versus standard diet. These were obese adults at least age 60. And this is the group where it's controversial about promoting weight loss because of the fear of loss of lean tissue and reduction in function. And what we found was the people on the low carb / ketogenic diet, they spontaneously reduce their calories because they're not hungry. And so it is calories, but it's also not calories, right? Obesity is a disorder of fat accumulation that's, I think, hormonally driven more than anything. And unfortunately, we live in an environment where the food industry is really good at creating highly palatable foods that become very addictive. So I actually think people can get 70 to 80% of the way there by just cutting out processed food, highly processed food. But it's really difficult to do because it has this addictiveness to it.
Yeah, absolutely. And it not only is it addictive, it's cheap, it's ubiquitous. We're encouraged to eat it. We're actually shamed for not eating. It's kind of like
Yeah.
if you eat healthy, people think you're crazy these days, which is which is a very unusual place to be in. Do you know? I was reading a paper last night. Maybe you're familiar with. There's some adipokines. One of them is called Omentin one. Are you familiar with that? I saw a ketogenic diet where they showed that was actually increased, and that particular hormone or that particular cytokine is associated with decreased insulin resistance, just improved outcomes when it comes to that.
Interesting. Not surprising. I should have started by saying I am not very physiologically oriented. I'm not a physician. And it's interesting. A lot of my colleagues say I know just enough to be dangerous because I'm very contrarian around what we're doing. But it's not surprising to me. I think we haven't even begun to describe the beneficial effects of this eating plan. And we're just starting to do that. The interesting thing now is the plant-based people and the people who really are adhering to the nutrition guidelines will say we don't know the long-term effects of this eating style, but we actually do know the long-term effects of what they're advocating, and it's chronic disease and diabetes and obesity. It doesn't take a genius to look at the food pyramid corresponding with the increase in obesity, and the majority of the increase in calories is from carbohydrates. So I'm not particularly intelligent or gifted, but to me that's a clue, and it's really hard to get people to get rid of their biases around this.
Yeah, I mean, one of the criticisms is, people don't actually eat the food pyramid. We have
Yeah,
recommendations, nobody's eating it. I mean, they've shown that, we have increased our fruit and vegetable consumption. We have decreased our saturated and fat consumption based on food loss data. But at the same point, most of what we're eating is processed garbage. And I think, like you'd mentioned, getting rid of that. Now, one of the, issues with trying to tell somebody, let's go eat a food pyramid guy where you eat, whole grains and a bunch of, plant-based, a bunch of legumes, is that no one really likes that. And you become hungry and then you just binge on ice cream.
yeah,
It's just like it's impossible to do that. So if you're not providing satiety with something that's got some nutrition, and again, I always default to steak and eggs and things like that. They're
yeah.
very satiating, producing. Let me ask you a question on your study, the ketogenic study that you did on the cancer patients with the women with the ovarian cancer. What was protein like? Was protein? I mean, did you guys equate for protein? Did you?
Yeah, let me give you the macronutrient breakdown because
I'm sure you don't have it off the top of your head, yeah. But
well, nutritional epidemiology, as you know, is kind of a ridiculous science.
Right. It can be, yeah, for sure.
If I asked you what you ate, you would know because you eat the same thing all the time.
Right.
But if you ask the average person, they have no idea what they ate yesterday. But we did some food recall on the patients randomized to the two diets. And so let me give you the breakdown. The ketogenic women ate about 62% fat, about 30% protein, and 9% carbs. And the control women that were on the Cancer Society diet, 35% fat, 19% protein, 43% carbs. So actually that 43% is probably a little lower than what the government recommends at the moment. And again, these are based on self-report, but we did not control for protein. We didn't put them on comparable protein, but 29% protein is that higher than sort of what the typical person consumes now?
Yeah, the typical standard American diet is around 15% protein.
Yeah.
Wide diets across the world tend to be run, kind of naturally go about 15%, which I think is about half as much as it should be, honestly. But that is what's pretty typical.
Well, and I think it helps to explain why they didn't lose a lot of lean tissue as well. And I this fear of protein this kidney stuff about protein with these types of diets. I've never seen any evidence to really support that it damages the kidneys. It actually seems to improve kidney function, as far as I can tell.
Yeah, and there's actually studies that have come out that actually have shown that. I mean, Stu Phillips' 2018 review on high protein diets and kidney function pretty conclusively shows that there's no actual evidence outside of, again, this epidemiological associational nonsense that would indicate protein actually damages kidneys. And in fact, it does seem to improve, particularly when you substitute protein for refined
Yeah.
carbohydrates and some of the other processed foods, your GFR, your glomerular filtration rate improves.
Yeah.
When, and I guess that's, some people would say, well, maybe it was because of the higher protein in the diet. The 43% carbohydrate, I've seen that even quoted as a lower carbohydrate diet, when we look at the standard being 55 to 60%. So I was just looking at another paper last night, and they basically used low carb diets where I think they wanted to call them 23, they called strict low carb diets. They called something like 23% carbohydrate, and then moderate low carb diets they called 43% carbohydrate. And, they had some different outcomes on weight loss, and the lower carb group did better, not surprisingly, as we've seen that all the time.
Well, it's interesting. So I have a colleague who did a study with polycystic ovarian syndrome, right? Which apparently really is driven by insulin and insulin resistance. They put the women on a 40% carb, and they had remarkable benefits. So I think what constitutes low carb is lower than what people are typically encouraged to consume. And if you can go a little bit below that, I think you will actually begin to see health benefits.
Yeah, and I guess some of the critics would say that, it might be well, I mean, there's some that think all calories are the same, and it doesn't matter what the macro, it doesn't matter what it is, as long as protein is equated, and, a Twinkie is the same as, I don't know, broccoli, I suppose. But there's others that will say, it depends on what the carbohydrate sources are coming from. Is it cookies and Doritos, or is it, fruits and vegetables type of thing? And so I think, you can't dismiss the food quality aspect of this. So let me ask you, so what do you, day to day, what are you working on these days?
Well, I'm working with a colleague we have a department of nutrition sciences here in our university. I'm working with her. There's this remarkable difference in the in insulin sensitivity and the ability to clear out insulin between African Americans and Caucasians. And we know that African Americans, particularly women, have, although they tend to be obese, they tend to have a lower risk of mortality, partly because a lot of their body fat is stored below the waist. They don't have as much visceral fat. So we're actually doing a study with African American women with diabetes, and we're randomizing them to either the low-fat diet or a ketogenic low-carb diet, and we're trying to look at what happens over time to their insulin. And we do what's it called, OGTTs. We test how fast they clear it out, and remarkable differences as a function of race that we're finding. And COVID set us back in terms of recruitment, but we're probably about halfway through that study. And the interim look at the data suggests that it's really, really effective. And that we're also doing so we're providing the food, which is the other kind of neat thing about this study. And they're going to also go into a free living phase for 12 months, where they'll be able to choose whether they want to stay on the diet they were randomized to or go to the other diet. So, and what we're finding is a lot of the low-fat women want to try the low-carb because either they've tried it before, or they know or they've heard it's probably superior. So we're doing that one. And then I'm involved in another study, which I'm excited about, with exogenous ketones. It's funny, when COVID started, we have a colleague who produces these exogenous ketones, and we try to get our infectious disease people potentially interested in it to treat COVID, when they come into the hospital. We were not successful, not surprisingly, but there is some anecdotal evidence that people who were like hours from a ventilator would take some exogenous ketones and go home in 3 days, never get on the vent. So we're trying to see if we can apply that to cystic fibrosis, the inflammasome. So what happens with that disease is every few months they have an exacerbation and require an inpatient stay. So we want to get these patients and randomize them to either the exogenous ketones or a placebo and look at what happens to their lung function over the course of the standard of care while they're there. And so we're trying to recruit for that at the moment. So I'm really excited about that. We also have a trial of exogenous ketones for post-concussive syndrome for young athletes. As you probably know, in Alabama, a lot of football players, a lot of young kids that play football or soccer, and they get hurt. So we're trying to see if exogenous ketones can help to improve the recovery from that syndrome, which actually can be, in some cases, quite severe. So I'm excited about that. One of my concerns, obvious, I think everyone would benefit from a low-carb, ketogenic, carnivore-ish diet, but very few people can sustain that. So we're trying to see if the exogenous ketones might produce some benefit and whether they can be used in conjunction with maybe even just a low glycemic diet to actually confer some benefits. I know it doesn't stay in the system as long. You get acute effects, but that's kind of where we're going. And we've tried to get, a colleague and I have tried to get interest for Alzheimer's here, for Parkinson's, a lot of the neuro stuff. But whenever we present it, they look at us like a deer in the headlights. They just don't seem to grasp. If the only tool you have is a hammer, everything's a nail, right? So anything outside of their area, they're very skeptical of.
Yeah, and most likely they have no clue about it. One of the, I know there was a study at the University of Alabama, Birmingham, 2 or 3 years ago looking at low carb diets and knee pain. I don't know if you had any input on that or knew about
I
that.
was not involved in that, but I'm aware of that study. Yeah.
Yeah, it was interesting. It showed that arthritic knee pain was much decreased on a low carb diet relative to a low fat diet. I thought was also
Yeah.
interesting.
And these are osteoarthritis patients, right? It was always thought it was wear and tear and cartilage damage, but there's probably something going on inflammatory. And of course, this as an orthopedic surgeon, there are people that can have bone on bone and they don't report any pain. And there can be people that have normal looking knees and they report terrible pain. So it's hard to know what's going on. We also have an exciting trial where we're going to try to apply this diet to fibromyalgia and chronic fatigue syndrome, because I think there's something going on, this neuroinflammation that the fibromyalgia people talk about. I think this diet, I think getting the brain to run on ketones is really, really therapeutic.
Yeah, interesting. And as part of what we're doing as our company, we're going to be doing a number of clinical trials in that regard, looking at diet and different disease states. So it's quite interesting. Just touching back on the arthritis study, there was another study that came out around the same time looking at insulin levels and these inflammatory cytokines being produced by the synoviocytes, which are the cells that line the joint, and saw a very significant correlation. High insulin meant high inflammatory and ultimately destructive cytokines in the joint. So it accelerated arthritis and probably led to inflammation and pain. And so, yes, clearly, I think there is more than just a mechanical phenomenon. There's a very big biological inflammatory component to even osteoarthritis, which was, like you said, I was trained that it was just wear and tear and mechanics, but it really turns out it's biology, and inflammation is probably a large part, if not a majority part of that. So it's kind of interesting. And I cannot tell you the number of people I've seen with arthritic and joint pain get better on low carb ketogenics and carnivore diet. So there's really something there.
And lupus also responds quite well. Anecdotally, we've had some people that have done really well. My perspective, to sort of nutshell it, is I think the standard American diet with the preponderance of highly processed foods is slowly poisoning us. And I think the body is remarkably adaptive in the sense that it actually takes years of miseating or eating this poison before it actually starts taking a toll. So I think the body is ready to respond and can heal itself with food. I think most chronic diseases, the diet should be the first line of treatment. Unfortunately, as you know, as a physician, that's not lucrative. Better to treat the symptoms with a chronic use of a medication than to actually get to the core of the issue. So until people take responsibility for their own health and realize that doctors only have one way of treating stuff, and it's usually like a shotgun, it's not very specific. I know our center here, we have a nutrition obesity research center here, and they just got a grant from NIH around this precision nutrition stuff, which is hot right now. But I don't know what they're going to be precise on. I have no idea how they're going to do this. I'm afraid it's going to be money not well spent.
Yeah, I mean, I think the problem with some of these precision nutrition or genetic-based nutrition is basically they're sort of optimized for these biomarkers that may or may not be relevant. Whereas I like to look at, did the patient get off the medicine or not? Did they lose the weight? Did they get off did their symptoms go away? Those should be the outcomes we're tracking. And if we do that and we can do things that are efficacious towards it, then I think it's worthwhile. But if you're just bouncing around biomarkers, it is kind of a waste. And, there was an analysis done by, I think, Goldman Sachs looking at the pharmaceutical industry, and they asked the question, is curing disease a sustainable business model? And the resounding answer was no, it's not. So that should tell you, where all you need to know about what's going on with some of this stuff. It's just in no one's interest. I mean, no one's financial interest to cure a disease other than the patient, of course, but they're not the ones that, this is not what companies are creating.
I must say, though, I am encouraged by the whole area of type 2 diabetes now. There is in Canada and parts of Europe, a little bit here, there are cohorts of physicians who are defying the standard of care and putting these people on low carb, ketogenic type diets. And they're getting off their diabetes meds. They're losing body fat. They're getting healthier. I did a little bit of advising for the Virta Health, which you may have heard of, which really, and they actually have a study, I think they're going to be publishing soon with vets, people in the VA, remarkable effects, remarkable cost savings. And that may be the way that we get this stuff, is if, Medicare and Medicaid can realize the cost savings from this, we may be able to make an impact. But I like to think that the type 2 diabetes world is becoming a model for how to do this. So I'm hopeful.
Yeah, there's definitely, I'm very well acquainted with Virta Health. And I think that, unfortunately, like you said, these little cadres of physicians that go out, a lot of them get maligned and sort of labeled as quacks and all this stuff, just because they're not practicing the quote unquote standard of sick care, which I think many of us and most patients are quite honestly tired of. But I do think, is there a breaking point? Have we reached a point in society where we look, you look around and you're like, my God, everybody literally is sick. You can't go out into a shopping center and not see, I mean, so many, either they're obese or they're limping, or you can just tell, they look at it and they don't. It's like if you went out in nature and saw a pack of animals and all of them look like they're on their death's door. You'd say, so what did they do? Did they eat from a poison, drinking water or something like that? It's kind of crazy like that, for sure.
It's amazing. I was thinking, when I was a kid in school, we might have had one or two kids that had a weight problem, but today it's almost 20%, which is astonishing to me. And you see people, I don't mean to be derogatory, but I call it carb face. Kind of they look really inflamed. And, go to a beach today as opposed to 15, 20 years ago, or look at photographs from the 50s. It was very rare to see someone even overweight, never mind morbidly obese like we have. About 7% of US adults are at least 100 pounds over their ideal body weight. That's criminal.
Yeah, that is very, very disturbing statistics. And yeah, I mean, when I was a kid, and again, I grew up in the early 1970s, but I mean, we had the fat kid in our. I mean, that was it, the fat kid. It wasn't. Now you've got. I mean, it's going to be where you've got the normal weight kid. I mean, well, look at that kid. He's kind of weird. He's not overweight. Yeah, but I mean, it's disturbing when we see 20% of our youth, and I mean, adults right now, I think it's 45% are considered obese, and 78% are considered overweight. I mean, you are in the minority if you're of normal weight these days. So it's
3/4 of adults are either overweight or obese.
Yeah,
in this country.
That is a statistic that should I mean, I know we have a lot of problems in the country, but I mean, gosh, that seems to be that should be job number one. And
Well,
there's
it's funny, the other thing with the COVID, about 80% of the hospitalizations are among obese people, but you can't say that, right? You're not allowed to say that. Um, but we knew early on who the vulnerable people were and what we needed to do. And we seem to not want to tell people what is self-evident, that if you have a metabolic disease or you're obese, you're already in an inflammatory state. And when this virus comes, it wipes you out. It literally takes away your ability to, because your immune system's already compromised. Obesity is accelerated aging. And so an obese person who's in their 40s or 50s is probably physiologically in their mid 60s, if not 70s. And that's what's driving a lot. It's very frustrating.
Yeah, that's an interesting. I was there was a article that I was made aware of. I think yesterday, the day before, and it was talking about caloric restriction and longevity in humans, and basically what the data in humans show is it doesn't, unless you're comparing it to obese controls, caloric restriction doesn't seem to be the way to do that. But the one thing they pointed in there is that obesity was a, like you said, it was a dramatic increase in the aging process. So if you're obese, you're aging at a much rapid rate. And so that's really the win is to not be obese. So you can age at I guess a normal or
Well, it's
appropriate.
funny. A lot of the animal studies, the longevity studies, it's interesting when they cut them back on their calories. What they don't tell you is rat chow is predominantly carbs, right? Because it's very cheap to make. So what they're actually cutting back on is probably carbs and sugars. So is the longevity because of the caloric restriction or because of cutting back on carbohydrates and sugars? I'm
Yeah,
not sure I know.
the other thing that I've seen, I talked to Don Layman, who's a sort of a giant in the world of protein research, and he basically said, lab rats basically overeat by 30% anyway, and
Yeah,
so they're already overeating, and so
yeah.
you basically bring them back to a normal level. And one of the things that I thought was interesting when you mentioned this is, there's studies I think on dogs and outcomes, and when they cut back on food, they improve their outcome, but they don't sort of highlight on the fact is the food they're feeding these dogs is dog chow. It's not actual. What I think a dog should eat is basically what a wolf eats, is basically a
Yep.
meat-based diet. And
Yep.
so like I said, when you're removing this pet food, which it closely mirrors what humans are eating now. I mean, we're basically being fed processed human pet food. I like to call
Well,
it that.
we have an obesity epidemic among dogs and cats now.
Yeah,
It's not
sure.
surprising. And we're seeing the same thing with them. Feline diabetes is epidemic now.
Yeah, I've seen some dogs that just shocked me that they're I mean, it's literally like animal abuse. You see a dog that is literally 40 pounds overweight, and these aren't big, these are smaller creatures, and they're 40, 50. They're literally morbidly obese. They've got rolls of fat on them. It's like, and they're not a Shar-Pei dog with this loose skin. It's just like a lab that's like, can barely walk. And you can see it's arthritic and the skin looks bad. And and anybody can do this experiment. You don't have the ethical, I guess, constraints with that, but you can put your dog on a natural whole food diet, meat-based diet, and you immediately see them get better. I mean, it's shocking. Their gray hair turns back the normal color. It's
But it's
quite.
interesting. We had Tom Ziefried here a couple of years ago, and he showed some slides of a dog that had cancer, and they just fed it whole chickens. And like 4 months later, the tumor was essentially gone.
Yeah, I've seen those. I've seen those results with them. And you'd mentioned brain cancer. We had interviewed Pablo Kelly, who's I think he's 8 years into his
Yeah.
I think he had a glioblastoma diagnosis, and Andrew Scarborough's another one. He had, I think, an astrocytoma. Both these guys, low carb, ketogenic, meat based diets. They are. This is the thing that I find interesting, because if you look at the medical literature and you talk to an oncologist or a neurologist, and they'll say, well, we know that there's spontaneous remission in 3 to 5%, and they'll leave it at that. They're
Yeah.
not curious. And it's like, well, why? Why are these people remitting and other people aren't? Wouldn't we want to know that? And
Yep.
we should be climbing up those people with a microscope and saying, what the hell did you do? We don't see that, and I
Well,
think.
we actually had some talks with some neurologists here with the glioblastoma. And, we had access to a facility where we could have actually kept them for a couple of weeks and controlled everything. And, we had proposed to do a small pilot study to, change their diet. And the neurologists actually said that getting a diagnosis of brain cancer is such a traumatic issue that changing their diet could be too stressful. Which, I mean, if you're scraping that as a rationale for not doing it, that's pretty sad.
I mean, I remember when I was doing my surgical residency, and it might have been medical school, but it was some of these advanced cancer diagnosis. The treatment was just like they called it 6 PFP. It was like a six pack and a fishing pole. Here, go get drunk and go fishing because there's nothing we're going to do for you.
Yeah.
And yet you're afraid to put them on a because really, I mean, when you look at a low carb diet, it's very often just a low processed food diet. It's just like cutting out the processed garbage. And to say that that's somehow dangerous is it sort of questions sanity that you would do that. And like I said, I don't know. It seems like you just need to take these people and pick them up and shake them, shake some sense into them. But I guess you just have to keep plugging away. And I see more of its grassroots. This is what we've got this community here. We're all sort of like, hey, we all kind of realize that the system's broken and we don't want to participate in it any more than we have to. And some people are kind of more or less married to the medical system, but many of us are able to sort of step away from that and realize better health from that.
Well, it's interesting. So I've been sort of keto / carnivore for probably close to a quarter century now. And I've given up going every time I go to my physician, right? She wants to put me on statins. My LDL is too high it's not within the. So one time I brought her a stack of papers arguing that it's meaningless for heart disease if you're within a context of a low inflammatory state, if you're not eating carbs. And they just ignore it. She actually said to me, I'm not smart enough to know, but the standard of care is that I'm supposed to recommend a statin for you.
Yeah, and that's very much. I think that experience is echoed by a lot of them, and it may not be. I don't know about smart enough, but because it doesn't take that much brains to read some of these things. Particularly as a physician, you're already versed in the language. But
I think it's courage more than smart.
But it's courage, and it's also having the time. Like I would have patients come in and they would bring me stacks of literature to read, and I just didn't have time.
Yeah.
Like I'm busy, man. I don't have time to read, to spend 2 hours reading all this literature. I got 50 patients waiting to see me.
Yeah.
Sorry, dude. I mean, when you get plugged into that medical and healthcare system, you're like a rat or hamster on a wheel, just spinning. And most of your education is here, go to dinner and listen to this drug rep talk. That's your downtime. They just continue to sort of bolster the sort of the standard of care mindset, and it really is. It can be tough to break free from because like I said, it's not the physicians are bad people in most cases.
No,
there's
so many competing interests in medicine.
Right. Sure.
And that I just saw a paper the other day that's looked at the conflicts of interest on the people who are on the committee that comes up with the nutrition guidelines.
Yeah, that's Nina Tykos is on it.
Yeah,
95%, 19 out of 20 had significant conflict of interest with food industry. Making our dietary guidelines. And like I said, USDA's job is to promote agriculture. And what is agriculture in the US? It's rice, wheat, corn, soybeans, sugar. And so we don't have a very, I don't think we have a very transparent or, our food guidelines are not to make us healthy. I think that's pretty clear.
I tell people to do the opposite of the food pyramid, to flip it. And that's much healthier for you.
Well, it seems to be. I mean, you can demonstrably see that. And like I said, the nice thing about health is it's pretty easy for each of us to assess it. I mean, we can look in the mirror and know we can just look in the mirror and say, hey, look, I'm better than I was 6 months ago. So it's harder than to pull your wool over the eyes. Some of these other things that are out there, I don't know. I'm not an expert. I'm not an expert in all these different sciences, but I can look in the mirror and know when I feel better, and that's pretty easy and obvious for me. But even then, there's people that will tell you, and it's kind of a shame. You'll get people go to the doctor's office, and they'll feel awful, and the doctor will run labs and say, "Well, your labs look good. Nothing wrong with you. Go on, just kind of run along your way." Or we have all these quote unquote idiopathic diseases. I mean, I look at that. We're too stupid to figure out what the cause is, and it's probably lifestyle nutrition based, but we don't want to do the work for that.
Yeah. Well, but that's why you have your network here, right? These are the zealots. These are the people who know there's a better way.
Right, absolutely. And like I said, as much as I was bemoaning the fact that we don't have these, I don't know if he's in here today. We got a guy who's got MS, and he's literally curing his MS
Yeah.
right before our eyes. And it's like this guy's, these people are rock stars. These are people we need to be studying and emulating and asking questions and seeing if we can reproduce it and see how many people it works for. And that's how you develop these sort of protocols by going to people that have actually said, I'm not going to learn how to be an excellent basketball player by studying the guy that sat third string on the bench in high school. I'm gonna be following Michael Jordan or somebody like that, somebody that's actually achieved great success. And if you don't study those people, you're kind of crazy, when it comes to this stuff.
Well, it's interesting. So we had a colleague who had Parkinson's. He has Parkinson's, and he discovered bulletproof coffee, right? So he puts the MCT oil in the butter. And about 15 minutes after that, his tremors essentially stop for like 2 hours. And so, I mean, that's very powerful. You would show that to a Parkinson's specialist, and they wouldn't believe it. They would think the person doesn't really have Parkinson's or something.
Yeah, I've seen that on a number of occasions where people come in with a diagnosis that's confirmed on imaging, lab studies, and then it goes away. And I've had people with say things like ulcerative colitis, and they'll go in, they'll get a follow-up endoscopy, and it's gone. I mean, there's no evidence. And then the doctor will say, "Well, maybe we misdiagnosed you." I mean, this is the sort of thing because their brain can't compute that.
Yep.
Hey, they got better. It's like as a physician, you can't believe it's shocking when someone actually gets better to the point that you don't even believe it. And it's like that's the whole point of you being in this profession is to get people better. But when they do, they actually reverse their disease or no longer need your care of medicine. You deny it as a possibility.
Well, and then you get the physicians where a type 2 diabetic learns about this kind of stuff, does it, comes back 6 months later, everything's normal or normalized. And the physician will say, "What did you do?" And they'll tell them, and they'll say, "Well, we don't know the long-term effects of that. All the parameters are better, but somehow it's going to mysteriously all fall apart in the avalanche and kill the person." I just never understood that.
Well, I don't either. I'm certainly in there. I'm perplexed. I mean, it's one of those things where, well, we do know the long-term consequences of remaining obese and miserable and inflamed and, whatever, all these things we can measure that don't make sense. But yeah, it's an uphill battle. I mean, like I said, you've got, like I said, Verta Health is doing some great things. I mean, what we're going to be doing is similar and also great things with regard to this thing. I'm optimistic. I mean, otherwise I wouldn't be here. And I think there's at the end of the day, it becomes out, well, who benefits, and who benefits financially. And like I said, I think you can get people healthy and still there can still be financial incentive that it may not be for a pharmaceutical company or a healthcare industry, but who's going to benefit? Well, the patients themselves, obviously, and then their employers, quite honestly. Their
Yep.
employers are, I mean, they're paying tremendous amounts of money in healthcare costs. If you get insurance from your employer, particularly if they're self-insured, they're throwing away. I mean, they're literally spending millions of dollars in significant parts of their budget to deal with that. And if you can get that off, that would
Well,
help.
imagine if a pharmaceutical company could create a compound that produced all the beneficial effects of a carnivore or keto diet, right? It's not possible.
Right. Well, I mean, I saw in one of your neighboring, well, not quite next to it, well, Louisiana. There's the University of I think LSU or somebody's looking at an exercise
Yeah.
pill. I saw that where they're going to mimic the benefits of exercise in a pill. Obviously, I'm very skeptical about that, but that's what they're trying to do. And they're like, well, you don't have to actually physically do anything. We'll just take a pill, and there's
Yeah.
people who sign up for that. As long as I can continue to eat my junk food and hang out and watch Netflix all day. I just take a pill and I'm good to go. And there's some people that I mean, to me, that you're almost dead at that point. You're just waiting to die at that point.
Yeah.
Not sure what you're doing at that point.
Well, and we underestimate how satisfying this diet is. We don't really convey that enough, right? So you're not hungry, you feel satisfied. There's a variety of stuff you can have, and There's something that physiologically, when you eat stuff that's nutrition, your body just starts really singing. It really starts operating the way it was designed. And that feeling is, I think once people get that feeling, they have to stick with it for a few weeks. But once they get that feeling, I don't think there's any going back.
For many people, I see that for sure. And I, like I said, man, I like eating a steak for breakfast and steak and eggs for breakfast. I'm completely happy with that. I look forward to every meal. It's not a chore or drudgery to me, like I said, and I find it, yeah, I mean, most people, they almost feel like they're cheating. Like, what do you mean I get to eat steak and bacon and eggs and cheese and things like that? And I mean, a lot of people, because they've been taught that, oh my
Yeah.
God, it's so bad for you. And then we've got the other push that it's bad about the environment. I'm always trying to do the work to let people know that this is not the case. But it's a battle. It's definitely, and you're up against very well financed and very media savvy and excellent propagandists to sort of
Yeah.
convince you to
Well,
do that.
now that the dietary fat hypothesis has been essentially shot to crap, they're trying to find other ways to, I actually think, unfortunately, Ansel Keys was probably the person who destroyed public health in the 20th and 21st centuries by his, selective use of data and his adherence to this. And he had a very powerful position in the government, which allowed him to really position himself as the authority. Turns out he's wrong. And we're going to pay that price for another 2 or 3 generations, unfortunately.
Yeah, there and well, and maybe even longer, depending. I mean, I think if the industry gets what they want and they want to decimate the meat industry and remove it from the diet, like I said, every time I mentioned, we, as when we sort of demonize lard and butter and things like that, it wasn't replaced with some sort of healthy alternative
No.
fruits and vegetables. It was replaced with, synthetic garbage. And they're doing the same thing with meat. They're not replacing it with fruits and vegetables and these so-called healthy foods. They're replacing it with this more processed slop. And
Yep.
that's where we're headed unless enough people decide they're not going to do that. And I
It
think
amazes me. It amazes me. You go to a convenience store or a supermarket, how many non-food things there are that are food, right? That you consume. Then it's not really food. It's synthetic food, right? I think Michael Pollan calls it food-like substances. It's not food. Look
yeah,
at the
I mean,
ingredients.
it's kind of funny. I go to the grocery store and I mean, I literally, it doesn't even register in my mind that that's stuff I would even consider eating. When before, you'd walk through every single aisle and it would just be, okay, what I want from here, what I want from here, what looks good. This is, 10 years ago. Now I'm just like, I'm usually, I go to pick up something that we need, maybe some eggs. And then I'm like, okay, let me go swing through the meat section, see what they got. And that's it. I mean, that's
Yep.
it for me for the most part, and it's like the rest of the stuff is just like a waste of space. I'm like, why am I walking? Why do I have to walk so far? Not that I'm lazy. I'm like, they gotta walk all the way and they do that. They intentionally put the real food at the back of the store. So you
Yep.
gotta walk through
Yep.
all the crap, how they lay out grocery stores with the design to get you to buy, whatever, do these impulse buys and stuff. So, all right. Well, I've got just a few more minutes. I got to do another interview here in just a few minutes, but
Yeah,
let
I
me,
just
let me
wanted to,
ask
so
you.
hey,
Yeah. Oh, you got the book. Okay.
got the book there.
Appreciate it.
I think I was one of the first to order it.
Oh,
I love
nice.
it. It's really
Okay.
good.
Well, hopefully you found it enjoyable. Yeah, it's kind of funny.
I'm not, I must say I'm not full carnivore.
That's all
I
right.
I find that I feel a little better if I have a sweet potato maybe 2 or 3 times a week. I don't know why. It's probably a placebo thing, but I get really run down when I just eat meat, and I
Oh,
can't tolerate eggs, unfortunately.
okay. Well, I mean, it is what it is, and you do what's best for you. This is the thing. It's not an ideology, and I'm
Yeah.
not here to convert people to a religion like a vegan sort of situation would be. I always say, do what works for you. And so, I at the same time, I'll say meat, I think, is a superfood. It's a health food, and we need to eat more of it, not less of it. And I think that's an important thing. Well, let me know. Maybe some people are curious to find out maybe what you're up to, or where they can find the studies, or how to get a hold of you,
Yeah. So
social media and stuff.
I was going to say, if you'd like, I could, I don't know if there's a portal, I could submit some of the papers that we talked about if people were interested. We recently wrote a review article on the effects of the ketogenic diet for cancer. Pretty comprehensive. I'd be happy to
Sure, sure. You know what?
send that out to
If
people.
you can, if you can send it to community@rivero.com. So REVERO community@rivero.com. Then Felice will be able to take it, and then
Okay.
and we can get it on the. What we do is we have a lot of research that we put up on our website. So we're always adding studies. We've got a pretty large collection of studies, categorized by a different topic, whether it's cardiovascular or protein intake or kidney disease or cancer. So we'll just add it to our collection, and people want to read that. That's great. It's a great way.
I just put my email address in the chat if anyone wants to
All right. So
extend this.
Fontaine 1. So
Yeah.
it's kind of, you have to have, so they only allowed you a certain amount of characters. Sounds like
Yeah.
Well, good. Well, keep up the good fight.
I tried meat eater, but they didn't like it.
They didn't like it. They probably, yeah, it's kind of crazy now. All right. Well, thank you so much, Kevin. I appreciate the chat. I appreciate the work you're doing. And like I said, if you want to come back, if you get another paper that you get out there, you find it.
Yeah, I'd love to come back and chat some more, because
we'd love to have you.
Really interesting stuff.
All right, everybody.
I want to thank you all for your courage to defy the prevailing nutrition guidelines.
Yeah, well, we're all up for a fight, so we're good for that.
I'm going to go finish my push-ups now.
Good for you. All right, go get them. All right, everybody.
Take care.
See everybody tomorrow. You guys take care.